Doppler.
And finish. I
want to do Doppler.
Abляցիայի բավականին շատ.
Yes. No, you came out.
Բավական լավ. Ոչ թե բավական շատ.
No.
It's not shutting.
It's over ablation, huh? It is ablated completely.
It is ablated, but I want to...
Don't twist, just pull it, yeah. Now you can see the white bubbling. The antenna tip is 331 mm slowly. It's like ceramic antenna. The white gasification very slow. So we use low watts, long time for uniform cooking, less carbonization. You can speak in Armenia.
Yeah.
You can do that. Yeah, take it.
I think we can wait for bubbles.
Yes.
Okay, not
Yes.
because the position is good. We are in center.
Yes.
We don't need to move now.
Yeah. You can speak in Armenia.
Մենք հիմա անում ենք աբլյացիան, հիմա կսպասենք, որ ինքը տակացնելու հաշվին ոչնչացնի եւ դա ուլտրաձայնով կտեսնենք հիպերեխոգեն պղպջակների առաջացումով։
Put 60 watts. And here.
Yeah, I have a job.
Okay. The same direction what you have gone. Yeah, come. Yeah, it's very good. It's enough. Little bit. Enough.
No.
So start.
50.
You can use 60 if you want. 50.
50, it's good.
Good.
Cooling.
Yeah. Their foot switch.
Ով ինչ ես անում, ջուրը փոխել ես cooling արա։ Okay. Cooling temperature error. Խի։ Давай, հա։
Wait.
This hold.
Yeah.
Ցապկա կամ։ Լավ, ես հենց կբռնեմ իրա։ Ոչ։
So we are doing artificial ascites posterior side, which is because of it is a case of previous cesarean section. So we are doing artificial ascites. Okay.
Foot.
Yeah.
Inject.
I am required. It's a perimetrium. You know, perimetrium. Yeah, give it the.
Չէ. Թեղուկը, ասիտ ենք անում։ We have a 2-3 time very good distraction of.
Yes, central necrosis, white patches.
Could you please color?
Color you can come.